Knitted blankets and hearts were introduced at the beginning of the COVID-19 pandemic as a way of sending keepsakes to families who could not be together due to visiting restrictions. They have since become the most popular and recognised resource during end-of-life care. As with any of the SWAN resources, their use should be discussed with the patient if they are alert and able, and with the family or loved ones. If you have a variety of blankets in your SWAN box, it may be nice for the patient or family member to choose a blanket. Once blankets and hearts have been given to the patient, they become their belongings and should not be sent off to laundry to be cleaned, nor should they be reused for other patients. Blankets are designed to place on the patient's bed as a way of personalising their care. They come in a variety of patterns and colours, so it may be nice for the patient or family member to choose a blanket, perhaps in their favourite colour. Once the patient has died, the blanket should be placed in a red hospital-issued laundry bag and returned with other belongings to the family. Relatives should be advised to wash the blanket inside the red bag at home at 60 degrees. The blanket will then be ready for use. As with blankets, hearts and teddy bears have been designed to bring comfort to patients and their loved ones. They can be particularly comforting when somebody close to the patient is unable to visit and can provide reassurance that the patient was or is not alone during this difficult time. The use of hearts and teddies should be tailored to meet the needs of the patient and family. And here we will demonstrate a few ideas taken from clinical areas. Using 2 identical hearts, give one to the patient to keep and the other to the loved one to take home. This can be helpful when visiting is restricted and could be sent through the post. Using a group of hearts, you can give a heart to a patient and then give out multiple different hearts to members of the family as a gift from the patient. Using identical teddies, give one teddy bear to the patient to keep and the other one to the relative to keep. Keepsakes for children. Give a bear to a grandchild or a child to remember their loved one. It could be a present from Grandad or just something to simply remember them by. Hearts and teddies can either remain with the patient after death or return to the family. This is a personal decision and should be discussed with the family. Infection control measures advise that any soft fabric items that have been given to a patient and then returned to the family should be in a red hospital-issued laundry bag and washed at 60 degrees. In our experience, the cotton hearts with the stuffing do not tolerate being washed, and therefore we recommend they do not come into patient contact before being taken home by a relative.